So now we're actually going to sort of show the sequence of dry needling. And I'll use myself as the model to start with, then I'll show you again on the model. Again, confirm you've got a trigger point. Use your checklist, more than half it's a trigger point. Pay attention to the pain referral patterns to sort of kind of assist you in this. 4 confirming factors, 2 from the patient or client, the familiar sensitivity or the right spot, the intense, distinctive, sort of good pain. 2 from the therapist, a tight band, a twitchy sort of jump sign. And then you go, okay, we're going to dry needle the area. Check your precautions and your contraindications. Check your anatomical landmarks yet again, and then use your palpation skills. One can use the introducer. It's handy to have a spare introducer handy. In this case, I'm just going to use the same introducer. And I will mark the area that I want to with the introducer. I will then, before putting on my gloves, or I can put my gloves on, again we described or discussed that there may be some debate about it. It's not necessary, but let's just say wear gloves. It's better. You've marked the spot with your introducer. You take your wipe, clean the area. Again, there's a debate as to whether that's necessary or not. One takes out their needle, their sterilized needle from the package. Removes the little tab. The patient's had the introducer placed on their arm already, so they know what to expect. You may sometimes just want to check if you can still see it, but you will be able to see it. Place the introducer over the spot. Quick tap. I actually felt that one. And then twist a little bit and then place the needle in. Like I said, I tend to work on the idea that I leave it for a couple of minutes and I come along and I twist a little bit more so I can actually feel the trigger point there. So, and then I take it out. Now, I may treat that area for a couple of minutes. It depends. I will allow the patient to control the situation. I encourage them to sort of breathe slowly through their nose, inhale through pursed lips. They'll be in a nice, comfortable surrounding. And I will deactivate all the trigger points in one area and move on. What I will do is I'll remove the needle. Now, I will then apply pressure over the area, either with the alcohol pad, and then I will replace the needle in the tube before going on to the next spot and needling there. Having finished that, again, having finished all the trigger points, all the muscles, I will take the needle, place it in my sharps box. There's no point in filling your sharps box with all the rubbish like this, throw that in the bin. But the needle has to go in the sharps box, and then that will be discarded according to my our local laws. So we're going to have a look at that now on the model. There's not a lot of difference, but you can see, I mean, I've not fainted, I didn't scream out in pain or anything like that. It's a pretty normal sort of sensation. It's not difficult, it's not that hard. Some people don't like it. Sometimes you get these myofascial corpuscles, which really does create quite a lot of pain. You just take the needle out and move it along a little bit, even like a millimetre, and then replace the needle and do it again, and they're okay. There's no point in just trying to go through where it's really, really hurting. Okay, so that's basically how we do it, and we'll go on to looking at it with the model. So now we've got a nice model lying here ready to be needled. To give you an idea how we're going to do it. I would have used my sequence for identifying a trigger point. I may even get them to just lift their back up to try and get the muscle to bulge and then relax. And then I will locate the area. I'm wearing gloves at the moment. Often I'll do it without gloves. And then I will get my introducer, finding the trigger point, I will then just place it on and make a mark and say to the model, this is your, that's probably worse you're going to feel throughout the whole experience. I will sterilize the area, either before I put my gloves on or with my gloves, preferably with my gloves. I will take the needle, remove the tab. Again, I can sterilize the area with a clean wipe. I'm going to place the needle over the mark I've made with the introducer at the angle required with the type of needle I want. Quick tap, needle is now in situ. Remove the introducer. Gently introduce the needle to the area. I can use a pistoning motion or a slight rotation just to get it in. It's now sitting in area there. Often when I will do that, I will just stretch out the tissue sometimes to allow me to do it, to allow me to introduce the needle in the right place. If they're experiencing any pain, then I'll remove the needle, replace it into the introducer. Handle first, so you don't stick yourself. It's hard enough with a handle. Catch it. Place it, stretch out the skin. Tap, needle in place. This is when I usually find stretching out the skin is more useful. Introduce the needle a bit more till you feel the needle grasp. Now, don't bend the needle, don't try and dig it around. It goes in, it goes in. The only reason if you have to take it out and replace it is if you get these like myofascial corpuscles, which is basically this area of extreme sensitivity, and so one moves the needle along. I don't want to be digging around or bending the needle or anything like that. I just leave it there. I then come on to removing the needle. If I'm going to reuse it, I will place it as I did, hand first, into the box to throw it away, and at the same time ischemic pressure over the spot, or if need be with an alcohol wipe. Sometimes the alcohol wipe's nice because it just cools the area. I'm just holding it on and relax, and then one throws the needle away, and that's the end of the dry needling technique. You can use the same needle in it for a number of times. Probably after about 3 or 4 times you want to go on to a new needle because it starts to get a bit blunt and then it becomes more uncomfortable for the patient. Please remember, don't bend it or hook it around or anything like that. So that's actually the needling on the model. Very nice sequence on how to do it. We'll have a look at a close-up how it works as well. So we've shown sort of from a bit of a distance how to do the needling, and now I'm going to show you again right up close. See the model's getting a bit of hyperemia here, so he's reacting to it. So I would have found the area. I would have removed the packaging. You can use the same introducer, but it's better to have your own introducer handy, just for marking. I will mark the area. So we get a little round kind of mark there. I'll put my gloves on. Wipe the area with a wet, not a wet wipe, an alcohol pad. I will remove the tab from the needle and introducer. Hold the needle and the introducer. Place the introducer over the mark I've made where I found the trigger point, at an angle if necessary. So I've cleaned it with the alcohol wipe. I'm now introducing the needle, pulling up the introducer. I sometimes need to stretch the muscle or the tissue in one way or another. I then introduce the needle into the muscle until I find it's going to bite. Often the patient will say, ow, well, that's the spot. As we said, if it's very, very, very painful and they're literally really not reacting well, then take it out and do it again. We can remove the needle. Again, stretch the tissues. Replace the needle into the introducer. And if we're doing another trigger point, or because of excess pain, we'll come up again, tap. It looks like he's got a myofascial corpuscle there from the reaction he just contracted. Needle into the area. I want to remove it. I remove it. Place the alcohol wipe over the area. Ischemic pressure. I then take the sharps box, throw the needle away, closing it. If there's any blood or anything on the alcohol wipes, then that can go in there as well. And that's the finish of it. That's how we will dry needle the area. Obviously, the patient needs to be comfortable when we're doing it, and telling us if there's any sort of problems or discomfort. One can see that there's an area of hyperemia here now where we've needled the model. It's having a little bit of a reaction to it, but that's quite normal. So that's how we do the actual needle application and for dry needling.